Hey guys, my name's Odette Blacklock. I'm a sports podiatrist, and here we're looking at heel pain or plantar fasciitis. And it's good to differentiate whether or not it is heel pain or something else. So you can have a Baxter's nerve compression, you can have fat pad atrophy, you can have Achilles tendonitis, Haglund's deformity, stress fracture, tarsal tunnel syndrome. So if you get the wrong diagnosis, then the treatment plan will not be for you. So plantar fasciitis is, if we break it down, plantar, bottom of the foot, fascia, connective tissue, itis, inflammation of that connective tissue. Specifically, the fascia we are going to address because a lot of people don't understand the fascia, and that is really the mainstay, understanding how it works, understanding how it recovers in order for you to get out of pain and keep this condition away. It can last up to 2 years, and it's very, very limiting. So having a look here, we have it for more than 4 weeks or it's returning. It is advised that you see a GP and you go for an MRI, ultrasound, to confirm what it could actually be. And then you may need, worst of all, is a surgical intervention if that is needed, but we want to try and prevent that, or to really offload completely and stop that inflammation process. So going into a boot, like a cam boot, as you see in that picture there. So the definition is pain and inflammation of the connective tissue, as we just discussed, and that pain is at the heel, the insertion of the plantar fascia and extends out towards the digits. It's pain on first few steps. So if you get out of bed, it's usually you feel that sharp pain, or if you've been sitting down for a little while and then you get up and you'll feel that sharp or dull pain. And it is confirmed with an ultrasound where there's 4 millimeters of thickening of that plantar fascia. Okay, so most people do have heel spurs, which you really can't do that much about, other than relieve the insertion into that heel, which would be that plantar fascia. Why don't people get better? I get asked this a lot because basically a lot of people don't understand the condition, don't apply the rehab exercises, and they're not kind of aggressive in the early days. Like you need to be on top of it, which will go through the 4 key steps and that treatment. Timeline, and if you don't get on top of it early, it does get worse and it can stick around for a long time. So understanding it and getting on top of it early is key. So fascia, plantar fasciitis, and if no one's explained what fascia is, it is connective tissue that actually wraps around everything, our organs, all our muscles, everything in our body is connected through fascia, and fascia is mostly water, okay, and collagen and elastin fibers. So when we look at plantar fasciitis, it's inflammation of that fascia, but it's also a breaking down of the collagen type 1 fibers. So they are more elastic, they can take up a lot of load, but eventually there's injury to those fibers. And then what happens is the laying down of collagen type 3 fibers. These are more immature, these are more disorganized, so they can't take up that load. And that's why people stay in a chronic pain cycle because they think, oh, I feel better. There's new collagen fibers there. It seems to be repaired, but it's not repaired with the same strength. And that's why I give you a strengthening protocol to be able to fully rehabilitate the plantar fascia so you don't get it again 6 months later, 12 months later. So that's why people stay in that loop. So really understanding that is a very critical point. So fascia is an adaptation machine. If you sit in a slouch position all day, it adapts to that. It adapts within 24 hours. Okay, so we want to really reprogram this connective tissue. It likes dynamic, elastic, fluid movement. Okay, if we don't keep the fascia healthy, it becomes sick, rigid, disorganized, weak, and that's definitely what we don't want for plantar fasciitis. So I'm going to teach you how to get strong and healthy fascia. Okay, so From here, we want to fix the root cause. We don't just want to mask pain, we always want to fix the root cause so it doesn't reoccur. So, understanding your biomechanics. I'm going to help you to understand how to load the foot properly. That is really key. It's obviously the plantar fascia is overworked. So, we want to have balance in the biomechanics and movement of the foot. Then we look at the foot to core reboot, which is part of my signature program, which helps us to really lift up and work against gravity and be strong within the muscles from the foot to the core. Okay, and applying that into your rehab program. And yeah, we'll learn how to prevent flare ups, which is really around step one, and looking at that holistic picture. So I'll tell you some other things to also keep your fascia healthy. So yes, we want to look at that holistic rehabilitation path to good health and healthy movement. So there are 4 core steps to your rehab plan or program. And in the acute phase, which means right now when you're in pain, it's day 0 to 7. This is where we need to be on top of it. This is where we need to make sure every day we are diligent in getting on top of that pain cycle. Then step 2 is really right now as well, all the way up to week 4. We're focusing on rest and restoration of that tissue. Then step 3 is week 4 to 6. We're focusing still on restoring the tissue, but stabilizing the foot and getting that tissue a little bit more responsive to stress. And then week 6 to 8, we're focusing on strengthening and increasing that load. So, step 1, day 0 to 7, we want to rest. The basic principle of RISA: rest, ice compression, elevation, and referral if we need it. So, rest from the activity. You can use a cam boot. Don't load the tissue at all. Okay. You can change your footwear to something like a Hoka that will push you through the gait cycle. Okay. That's a rocker soled shoe. Then make sure you rest from the activity that's actually making it worse. So, it could be standing and it could be running. Okay. Then ice every 4 hours for at least 20 minutes, not longer than that either. And then we have our Lodi taping, which you'll be able to see in the videos how to actually do that yourself. Compression sock is great if you don't want to use tape or you're allergic to it. Then we have our referral to a GP, and you may get those ultrasounds, MRI. Step 2. Now you've got a short video. So underneath this little video here, you've got all of your rehab exercises in video form. And so from here, you want to, again, see that GP if needed, that the Lodi taping. You can use that stretchy sports tape, which I prefer, supportive footwear, the icing, your foam roller exercises. So our plantar fascia, if it's really inflamed, and it's sore, just like a scab, we wouldn't want to keep stretching it and pulling on it, okay? So you want to use things like foam rolling and a calf release exercise rather than a calf stretch, which will keep pulling at that plantar fascia. And that's a big one that people a lot of times do wrong. They keep stretching and stretching and stretching, and it continues to get worse. And so watch that video, understand those exercises, and apply frequently there all your reps and sets. So on top of orthotic therapy, Lodi taping, anti-inflammatories can be really helpful. And I like natural anti-inflammatories like things like turmeric, but you can get your NSAIDs from the pharmacy, which is like Nurofen. Lead light therapy or red light therapy can help speed up the healing process. Compression socks are really good in taking pressure off that area. Extracorporeal shockwave therapy. So shockwave therapy I found it to be so helpful for so many patients to get really quick relief and long-term relief. So again, it really uses sound waves to break up any of the disorganized tissue, the scar tissue, the fascia. And then if we use things like cupping, if we use things like Graston, that can help us realign the fascia as we start to load it in the next phase. So really important shockwave therapy. Toe spaces to take any pressure off the structures of the foot and start to align the foot. So continue to go through that. Hydration is key because the fascia is mostly water. Okay, it's about 70% water. So if you were dehydrated, that fascia is sticky, it doesn't move well, it doesn't absorb shock well, and it remains painful. So hydration is key. And after you do your exercises or your myofascial release, the body will reabsorb the water just like a sponge. Okay, we push out the water, it reabsorbs it, and that can be so beneficial to help with your fascia health and healing. Supplements, obviously collagen, we talked about how that is being remodeled and replaced. So collagen supplements, greens, all of that stuff that's good for your health and good for your fascia. Cortisone, I'll leave some information about cortisone and PRP, but shockwave therapy tends to be quite good if you get in early. So shockwave therapy, I just explained, it's only a 5-minute therapy. You do it once a week for about 5 weeks. PRP tends to be very successful. Cortisone can tend to thin the fat pad and create more issues over time. So you need to be mindful about whether or not you want to do that and make sure it's ultrasound guided. You don't just want someone sticking a needle into your foot. So check those things out and read through those slides at another time. So step 3, you're going to get all your exercises for step 3. So this is week 4 to 6. And remember, we're only gradually starting to load that tissue now. So our toe spaces and our foot glove exercises, foot circling, creating blood flow, creating space in the fascia. Fascia needs space to be able to heal and move properly. You've got your kneeling plantar fascia stretch. So this is where we bring in a passive stretch. Okay, that's mean we're not being dynamic, we're not pulling at it, we're just holding that stretch. Then you have your ankle self mobilization. So a lot of people are locked up in the ankle. That means their muscles can't move freely. So really working on that bigger holistic picture. Foot tripod, okay, your foot and pelvic floor connection starts to come in. So if you've got good posture and you can hold yourself up, this is where this exercise comes in. Short foot is great to know for everything we do, okay? If our foot is weak, our core is weak, and we are not loading the structures of our body correctly. So short foot, and then downward dog, really working on that back fascial line, okay? So the superficial back line of fascia goes from the tips of your toes, so at the bottom of your foot, all the way to either the back of your head, and others say all the way to your eyebrow. So anything that is not flexible along that back line, you're going to have issues either from the head down through the back, hamstrings, calf, and all the way to that plantar fascia. So a downward dog is a great exercise. And then we use that exercise to actually strengthen the fascia under load and under eccentric load, which means a downward force. And so whenever we step, right, it's that downward force. So this is what we need to repair and strengthen. So that's a great exercise. And now looking at step 4, which is week 6 to 8, and we want to start to really be out of pain here. If we do have flare-ups, we go back to step 1. We go back to step 1 for, either a week or a few days until we're out of that pain. So hopefully we haven't been back there for a while. Week 6 to 8, this is where you really want to get your tissues strong. This is really where we need to focus and not just go, I'm out of pain, I'm not going to do it. We want to get a strong foot for life so it doesn't return. So continue with the exercises you've already been doing in week 4 to 6, but we're going to add on. We add on our calf raises with the towel underneath our toes, and all these exercises are listed, okay? And that creates a big stretch of the backline, superficial backline fascia, and again, strength now in the concentric phase and eccentric phase, so up and down. Okay, so we're really loading the tissue under length and stress. Then we have our tib raise. A lot of people gain strength in that foot. We went from short foot, and now we go into strengthening the tibialis, so the shins, okay, and the calf, front and back. Okay, that's the tib, anterior and posterior. All planes walking on all sides of the feet, strengthening the feet up towards the calf. Very important exercise. Heel hovers, so just learning how to hold the heel up off the ground, activate the foot, and create that load and tension along the plantar fascia without hurting it. We have our star, which starts to strengthen our leg as we balance, okay? So single leg exercises. So as we go into hopping and skipping, we are really loading the tissue with much more speed, and it's much more dynamic, and that really increases the load as well. So as we go through this, week 6 to 8, you can continue on. You can use these exercises in anything you do. If you've got a gym program already, still utilize these exercises to keep your plantar fascia strong and healthy over the years. And last of all, some recommended products you can purchase from my page, or if you already have them, that's great, or somewhere else. So recommended products, you need the sports strapping tape. It needs to have a little bit of a stretch in it. Then your fascia cupping set is great to create health and blood flow in that fascia. We have our toe spacers, such an easy way to get your rehab in by passively stretching the structures of the foot and keeping your toes aligned as you do your rehab. Then you have your fascia or trigger point release ball, massage gun. If we don't have time to stretch all the time, a massage gun is a great tool to really help us with our rehab, making it easy. Lead light or red light therapy, we can shine that onto the area of pain, and that will penetrate the structures um, of the tissue and help the mitochondria, okay, so the powerhouse within the cell, to speed up, and that will speed up healing. So we've got collagen supplements. I use True Protein collagen supplements and Celtic salt. So you don't want to use that Himalayan salt, using something like Celtic salt, just a tiny, tiny pinch in your water or when you're cooking, that sort of thing. It really helps with getting the water into the cell. Okay, so that's how we get water into the cell, is through using salt. So if we just drinking, it might just go through our body, but we really want that transfer of water into the cells, into the fascia, and we want that exchange. Orthotic therapy is a great way to offload the structures of the feet. If we're on our feet all day and we don't know how to align our foot and it's not strong yet, orthotics can be good temporarily before we get our foot really strong. Or we may have an anomaly where we actually need the orthotic for long-term. Foam roller, everyone should have one in their house. That's how you're going to get the exercises done for your fascia. Okay, hope that helps. All the best. Any questions, you know where to contact me.